Dr. Aimee Danielson, Director of the Women's Mental Health Program and the Mother-Baby Intensive Outpatient Program at MedStar Georgetown University Hospital. The Mother-Baby Intensive Outpatient Program is a program for pregnant and postpartum individuals and their babies. We work with women and birthing people who are experiencing moderate to severe psychiatric disorders, mental health conditions that have either started or worsened in the perinatal period. The perinatal period is defined by pregnancy up through the first year postpartum. The program provides a combination of psychotherapy, group therapy, individual therapy, medication management, and care coordination to help our patients connect with our services and to also help our patients connect with supports they may need in the community. I love getting to work with mothers. I myself am a mother, and this mother-baby program was initially conceived about 5 or 6 years ago. And myself and my team have been working really hard to be able to open this program to really expand the treatment options for mothers and families in Washington, D.C. And it's really a dream come true for me to be able to come here and work and support mothers who are suffering and prior to this program opening had no option like this, to be able to be in treatment where they themselves can be supported in their own recovery. They can be with their babies, and so their relationship with their babies is also supported in the program. They're not needing to separate from their babies to take care of themselves and be a part not just of their recovery, but also their journey in motherhood is a real privilege for me. And this is work that I've been doing for my whole career, and I feel grateful to get to come up and to be able to not just work with the patients and the moms and the babies, but also my team, who is a really comprised of experts who are loving and passionate alongside me and dedicated to working with moms and babies. The Mother-Baby Intensive Outpatient Program is a comprehensive program that was designed to support birthing individuals and mothers who are experiencing severe mental health conditions with their babies. So the program is intended to offer treatment and to support the mother-baby relationship. The moms that are and pregnant individuals that are participating in our program are experiencing things like depression, anxiety, scary thoughts, trauma, inadequate support system, and are really needing higher levels of support than maybe they've been able to experience before coming to us. Many people aren't aware that the leading complication of childbirth are actually psychiatric disorders. So the depression, anxiety in the perinatal period occurs in roughly 1 in 5 individuals who are pregnant and postpartum. And if you are talking and focusing on populations of mothers who are less resourced, less financially and socially resourced, where the rates are as high as 1 in 3. So this problem is extraordinarily common, and in its most severe form can be really devastating if left untreated for families that are experiencing these conditions. Our hope is that this program will help to decrease the stigma associated with mental health conditions across the board and mental health conditions in mothers. Efforts at MedStar Georgetown and across Washington, D.C. have been focused on identifying pregnant and postpartum people that are at risk for developing depression and anxiety through screening initiatives. And we have found that those screening initiatives have done a lot, asking the question, how are you feeling? What is your mood? What is your support system? And asking that in the context of obstetric care has done a lot to destigmatize these conditions. What this program really solves for is the gap in resources of where to refer those women who are screening positive. And so prior to the opening of this program, women who screened very severely depressed, needing a higher level of care, really had no option for being able to get treatment that was between an outpatient level of care, such as seeing a therapist or a psychiatrist once a week, and going inpatient into an inpatient psychiatric setting in the district. One of the key gaps that this program addresses is the interrelatedness between a mother's mental health and the health and well-being of her baby. And this program provides an opportunity to provide intervention that addresses both the mother's mental health, that relationship, and ultimately the mental health and the well-being of her developing baby. That's a really exciting aspect of this program for us, and was real intentional in the design of the program, is to make sure that babies were an intentional part of the program and their relationship, where mothers are learning how to respond to their baby's needs. Mothers are learning how to engage with their babies in a meaningful way. And in mothers with severe postpartum depression and anxiety, their bond and connection with their baby, their attunement to their baby, is often reduced almost from the noise of the depression and the distress itself. So what we're doing is we're supporting the mom in her recovery, and we're supporting her skills and her confidence in being able to relate to, care for, and respond to her baby in a way that makes her feel really good about who she is as a mother. So that's a really distinctive and unique feature of this program by design. The other gap that it fills is that prior to this program opening, we really didn't have that in-between level of care in our region. This is the first program of its kind that is serving mothers who need a higher level of care than traditional outpatient psychotherapy, seeing a therapist, for example, or even starting a medication with a psychiatrist. And what we're able to do then is offer them care with a goal of keeping them out of a hospital, of a psychiatric hospital. And the reason we want to do that is that our birthing people, our mothers and our families, many of them have come to us having suffered from the fragmented mental health and psychiatric care system that we have in this country and in our city. And that in addition to experiencing the mental health condition they have in pregnancy, they've suffered with not really having a place to get adequate treatment, a place where they felt they belonged, that was responding to their needs and the needs of their babies. This program was designed to solve for that problem, and to be able to have a place for mothers who need more treatment than seeing a therapist once a week, and to have a place for mothers who are being discharged from an inpatient psychiatric environment where their safety or their baby's safety was a concern, and that may have been part of how they led them to inpatient psychiatric hospitalization, that they have a place to step down to that is supported and attuned, that they're able to get enough care, intensive care, that can support them in their recovery, to ultimately then stepping down into an outpatient, seeing a therapist on a weekly basis. Mothers are encouraged to bring their babies with them, and we have worked hard to create a space where mothers are wanting to bring their babies and comfortable having their babies here. Mothers are caring for their babies, they're feeding their babies, they're putting their babies down for sleeps, they're playing with their babies, they are engaging and parenting their babies while they're in treatment, and our space and our team is there to support them in doing that. The goal there is because the mother-baby relationship is a central component of our treatment program. Being able to support them in developing confidence and parenting skills is a goal of our program. We also know that not having childcare for a newborn or for a 4 or 6-month-old baby is frequently a barrier to women getting the mental health treatment that they need. And we wanted to remove that barrier by saying, bring your baby with you. Part of how we've accomplished that is we have mother-baby helper volunteers in the room for treatment. So we have trained volunteers who are baby experts, baby gurus, that are there to help moms. So if we're doing, for example, mindfulness meditation as part of our groups, and mom happens to have a squirrely baby at that particular moment, we have a mother's helper volunteer that may hold baby, play with baby, give baby a bottle, soothe baby, sing to baby, so that mom can be hands-free while she's doing mindfulness meditation. So we really have a space and a program where babies are an integral part of what we're accomplishing here together. So our program offers about 10.5 hours of group therapy per week. Our program meets, it's a group-based program. It meets Mondays, Wednesdays, and Thursdays from 9 to 12:30. And mothers are together with their babies, with our clinicians, with our volunteers in a group setting during that time. That said, individual therapy and individual medication management, if that's appropriate, is a part of the treatment program as well. Most of our patients meet with their individual therapists and their psychiatrists on non-program days. Often that's done virtually through telehealth visits on Tuesdays and Fridays, but that is an integral part of the program as well. Group therapy is a really important part of the program because one of the critical factors of change that we expected and we're also observing every day is the mothers supporting each other. That many women experiencing perinatal depression, anxiety feel very isolated, they feel alone, they feel ashamed. And being able to come in and receive treatment and the support of other mothers who are going through many of the same challenges that they're experiencing is a really important part of the work that we're doing with moms. The Women's Mental Health Program has been at MedStar Georgetown University Hospital for about 17 years, and our program has grown significantly over that time. And we have a group of very experienced therapists, psychologists, social workers, psychiatrists. We've added a care coordinator to our team this year. We have a multidisciplinary group the focus of their career is working with women and individuals in pregnancy and postpartum. So very experienced, seasoned reproductive psychiatrists who are well-versed in the management of medication during pregnancy and lactation. Therapists, including myself, who've dedicated their career to treating maternal mental health conditions, and a team of very passionate providers, many of whom are parents, mothers themselves, that come together to provide outpatient care in the Women's Mental Health Program and then work together as a team to provide treatment through the Mother-Baby Intensive Outpatient Program. Intensive outpatient programs are really designed to be able to offer intensive treatment in the form of coping skills, skills to learn how to tolerate intense distress, parenting skills, ways to engage their social support, the help around them. And the intention is to develop those skills and to take those skills home and to practice them in the home environment. And what this does is it allows our mothers and pregnant people to be able to develop the tools they need to recover while caring for their families and while participating in their family life. And that's really critical because that's really how it happens. And that being able to give them a practice field, essentially, to be able to learn the skills in our group and then go home and see that as an opportunity to practice and then come back into group and talk about how it went, what they learned, what they're struggling with, to be able to work towards their own recovery. And that's really part of the program design. I believe people should choose us for their care because we really can meet a mother, a birthing person, a family where they are, and offer them the care they need where they are. Whether or not that care is intensive treatment, whether or not that care is couples-based treatment for a couple who's struggling with a transition to new parenthood, whether that care is connected to the mother-baby relationship, perhaps a mother who is struggling with her bond or her connection to her baby, and that she really wants to work with an attachment expert. that we really can respond and meet the needs of not just mothers, but of families who are seeking care that is really tailored to the needs of the family. And we offer all of those services at MedStar Georgetown University Hospital within the Women's Mental Health Program, within the Mother-Baby IOP, as well as in the broader Department of Psychiatry. The most common questions I get from the patients that I see is, will I be okay? Can I be helped? Will treatment work? And the answer is yes. We actually know how to support women, mothers, pregnant people in their recovery. And that it's often a combination of different elements that include psychotherapy, social support, peer support, seeking support from other mothers, self-care, and medication when necessary. These are really the 4 pillars of treatment. And for most birthing individuals who develop a mood or anxiety disorder during the perinatal period, these things combined work. And so this is really important for us. We get this question quite a lot. When we hear this question, we hear that mothers are really afraid. They're afraid they can't be helped. They're overwhelmed. Many of them have associated their depression with motherhood. And they fear that now that they'll always be a mother, that they will always be depressed. And so the question that we take very seriously, it's a really important, great question, is, can I get better? Will I get better? And the answer is yes. Help is out there. You've come to the right place. And that treatment works. You're not alone. And we're here with you to help you recover. Our program days are really full. They're packed really full. And in addition to being able to offer groups that are really focused on coping skills and recovery from depression and anxiety, we also offer a lot of additional groups focused on health and well-being. Groups that are focused on mother and infant sleep, for example, supporting mother and infant sleep, supporting mother and infant nutrition, supporting lactation, addressing challenges with feeding babies, addressing challenges with moving around the world with babies. We have a group called Baby Wrangling, where moms learn how to wear their babies if they haven't been wearing their babies, so that they can move around the world. They can make a sandwich for themselves while caring for their babies. We have doulas embedded in our program who will invite their moms to bring their baby carriers, to bring their swaddles, to bring their strollers. And if moms aren't sure about how to use some of these some of this baby equipment, our doulas will teach them real time how to do that. We also have a physical therapist who is teaching infant massage, a way for moms and babies to connect through therapeutic touch, also a way for moms to be able to help with their baby's digestion. We offer guidance and education about pelvic floor health. We have movement-based interventions, mindfulness. We have interventions focused on music and experiencing music, experiencing lullabies, singing with and playing with your baby. Lots of different interventions that are focused on enjoyment and relishing one's time with one's baby, as well as taking care of and nourishing oneself. So my philosophy of care really scopes out, and I really think about healthy communities. And for communities to be healthy, families have to be healthy. And for a family to be healthy, a mother has to be healthy. And her health is a combination of her physical health and well-being in her pregnancy. It is her mental health. It is the health and well-being of her children, her family system, her partnership. And so my philosophy of care is really not to separate physical health from mental health or emotional health and well-being. And that for true health and well-being, we need to be able to have this really holistic perspective. The mission of the Women's Mental Health Program is really to be able to incorporate mental health treatment, well-being, supports for mothers and families into their maternal and obstetric care. so that really we're thinking about the healthcare in a pregnancy, including the mental health and well-being of the mom as a necessary ingredient, if you will, into a healthy pregnancy. And that's really my approach and the reason why I work in a health system where I can partner with our OBGYN doctors, our maternal health specialists, is being able to have both obstetric, prenatal care, and mental health care side by side. It's a really exciting time to be in my field. My field didn't really even have a name 20 years ago when I began working with mothers right out of my doctoral program. And the field, the focus and the attention on family and maternal health over the last decade has really centered the importance of a mother's health and well-being in the health and well-being of her child and the health and well-being of her family. And that's really reflected in national and local policy. It's reflected in educational initiatives integrated into medical school training programs. It is reflected in the growth of maternal mental health programs across the US and in our region, in the number of providers that really have devoted their work and their careers to working with mothers and families, in the focus on growing a more diverse provider population, that all of these things reflect this enormous momentum in the field. And I feel grateful to be able to work in this field and to be able to drive the momentum and also benefit in many ways from that momentum. And that's part of what has enabled us to open up our mother-baby program. Where I see things moving forward is I see more opportunity. There's a lot of interest in the work that we're doing here at MedStar Georgetown. There is a lot of partnering that's happening across states, across the nation, to be able to increase access to specialized programs like the mother-baby program all across the United States and in our region. So I feel really hopeful. I feel inspired. I feel excited, but I feel really hopeful that we're moving towards a place where the health and well-being of mothers is recognized as essential, as really non-negotiable in our communities, and that our families and our communities thrive because of it.